Hey, what's going on, everybody? Welcome back to the channel. And in today's video, we're going to be going over the scapula and going into a little bit more of the muscles that kind of directly influence the biomechanics of the scapula itself. So getting right into it, we have kind of the anterior, the frontal view of the scapula. So if you were to do like a coronal or frontal cut, this is kind of the side that sits on the serratus or on the back of the rib cage. So we have a couple different like bony prominences that are going on here. We have the coracoid process, which serves as an attachment point for the pec minor, the coracobrachialis, and the the short head of the biceps brachii. So with the biceps brachii, what's going on here for the short head, it's actually going to originate at the coracoid and then insert into, I think, the radiotuberosity, with the pec minor kind of originates on ribs like 3 through 5 and inserts onto the coracoid. So it helps out with some of the, protraction and stabilization of the scapula. With the acromion process, what we have is this serves as an attachment site for some of the deltoids and the trapezius. So some like the lateral deltoid helps out with some abduction or kind of abducting the arm away from the body, taking it away. And then for the middle trapezius, this serves as an attachment point for it as well. We have some fibers that ran transverse. Most of the fibers run transverse for the middle trapezius, and they help out with some more of the retraction of the scapula. Then we have the glenoid cavity, which serves kind of as that articulation between the glenoid cavity, the scapula, and the humeral head, kind of that ball and socket joint, very similar to, like, let's say the hips with the acetabular of the pelvis and the femur and the femoral head of the femur. We have a couple of different articulations here. We have the lateral border, the superior border, not shown as is the medial border, and then we have the scapular notch. Now, the scapular notch can be almost interchangeable with the suprascapular notch, and that's going to give rise to the suprascapular nerve, which innervates the supra and infraspinatus muscles of like the sits muscles, which are typically has the nerve root C5 through C6, which is kind of like that cervical area, almost more so like the brachial plexus. What's also not shown here is the supraglenoid tubercle, which usually sits just above the glenoid cavity, and that allows for an attachment point for the long head of the biceps. Next up, we have the posterior, or more so rear view area, or rear view of the scapula. We have the supraspinatus fossa, which allows for kind of that runway for the supraspinatus muscle. Supraspinatus muscle actually inserts onto the greater tubercle, and what it does is for the first couple, like the early phase of abduction out of the glenohumeral joint, this muscle is doing a lot of the work there. Next up, we have the infraspinous fossa, kind of like where the body is on this image here. We have the body of the scapula with the infraspinatus fossa, like right here, which gives rise to the infraspinatus muscle. Now, the infraspinatus muscle actually inserts onto the greater tubercle, and what it does is actually helps out with the teres minor, with the external rotation of the humerus, and then the teres minor and teres major both sit right down here. Now, the teres minor actually sits above the teres major. The teres major sits inferior to the minor, but the major is a little bit of a bigger muscle. What the major is going to do is actually going to go a little bit more anteriorly and attach onto the lesser tubercle. It's actually going to help out with the subscapularis with the internal rotation out of our humerus. So that's kind of a little bit of a different view from the scapula. Next up, what we have is the a different view of the scapula through what we call like the medial lateral axis. So if you look at planes of motion, we have the frontal plane, which kind of divides the body anterior and posteriorly. What the axis of rotation does is it kind of draws a perpendicular line going through that plane of motion. So if you think about like the frontal or coronal plane of motion, a lot of the motions that occur there are flexion and extension. So if we have an axis of rotation going perpendicular through that, a lot of these motions are going basically through this pivot point of this medial lateral axis. So that's kind of a description of what this like image is showing us. And usually Supraglenoid tubercle usually sits right about here, and the infraglenoid tubercle sits on the posterior aspect, which gives rise to an attachment point for the long head of the tricep, kind of allowing for some of the elbow extension and scapular or shoulder extension, and then the supraglenoid tubercle giving rise to an attachment point for the long head of the biceps. So what other muscles influence the scapula? So beyond just the deltoid and maybe some of the sits muscles, we have a couple of different muscles that actually attach. So we have the rhomboids, the minor and the major. We have the trapezius. We have the levator scapulae. Now the levator scapulae typically is a muscle that originates right around like C, the first couple of cervical vertebrae on the transverse process, and actually inserts onto the superior aspect of the scapula. So when that muscle contracts, usually insertional origin, what occurs is we get a little bit of elevation, but then also downward rotation of the scapula. So if you look at the glenoid cavity here, what typically occurs with downward rotation is that cavity starts to point inferiorly. So that's usually what occurs when when the force is coming up this way, it causes some form of rotation to go downwards. Then we also have the deltoids. We have the triceps brachii. We have the latissimus dorsi. And the latissimus dorsi usually originates with the thoracolumbar fascia, and it inserts into the anterior aspect of the humerus. So it helps out a lot with like, you know, shoulder extension, some internal rotation, some adduction. So thinking about bringing your wrist into your back pocket. And then we also have the omohyoid, which which actually inserts onto the hyoid bone, and then through the intermediate tendon, it goes into the suprascapular notch of the scapula. So like right here, right there. So that is like the same kind of runway where the scapular nerve goes as well. So all of these muscles retain some sort of angle of pull that affect the biomechanics and the motion that the scapula goes through when we're performing exercises or just doing different motions with our arms and other associated limbs. Now there's a few other muscles that influence it. We also have the pec minor, like as we talked about before. So it's originating usually around ribs 3 through 5, and it's inserting into the coracoid process. So it kind of helps to stabilize and protract the scapula. With the biceps, right? We had the long head, which is originating right over here with the coracoid, going into like the radial tuberosity. And then we had the serratus, which is more of like a fan-shaped muscle that glides alongside the rib cage, helping out with some of the protraction and upward rotation, kind of like the force coupling. We also have the coracobrachialis, which also originates in the coracoid process and then inserts kind of on like the medial aspect of the anterior portion of the humerus. And then we have the sits muscles, the teres major. Now, all these muscles have some form of influence on the scapula itself. And what I also want to go over is the scapula is a little bit more complex than just the muscles that are directly attached to it. So for instance, right, we can take the pec major. Now the pec major has a sternal from to my current knowledge, it has a sternal head and a clavicular head. It doesn't directly attach onto the scapula. It inserts actually onto kind of like the anterior aspect of the humerus, kind of like the lap between two majors. So we have the teres major, the pec major on the most lateral aspect, and then we have the lat in between them. But if we look at the pec, right? So the motions that occur, we have some flexion, internal rotation, and adduction when we're contracting concentrically, right? So what is occurring here with adduction? The scapula doesn't just sit there. It actually glides and protracts in order for that motion to occur. Does it directly attach onto the scapula? May not. From what I know, it indirectly attaches because it attaches to the clavicle, and the clavicle attaches to the acromion. So it's an indirect attachment. So when we're looking to program exercises or we're looking to see what muscles can affect what joints or what muscles can affect what kind of bones, we need to take into account not just the muscles that directly influence, but also the muscles that have indirect influences, because these muscles uh, change the angle that the bone or change the motion of the way the bones move throughout our body. So it's important to consider all these when we're either looking into making a program, doing exercises, or just in general how we move, right? So if you guys have any questions, leave them in the comment section below. I hope you guys enjoyed this video as much as I did making it. I look forward to hearing from you guys, and thank you guys for watching. Here's to getting strong. Thank you.